Hi, my name is George Espenson. I'm Outreach Liaison for Hennepin County, and I'm here today. I have the great and distinct honor to welcome Dr. Walter Glisic, who is the Medical Director of our Traumatic Brain Injury Center. Dr. Glisic, Walt, as I know you like to be called, great to have you with us. Thank you.
Thank you for having me.
So what specifically, because obviously you had a lot of choices, when you graduated as a resident, what brought you to HCMC? I mean, what was the driving kind of force behind that?
The people. It's an incredible institution, and I was really interested and intrigued with the teamwork that was being done, especially trauma-related. I've been interested in all aspects of neurosurgery, but particularly trauma I found to be the most interesting, and still to this day find it the most rewarding part of neurosurgery.
Yeah, I can only imagine. So when you think about a typical traumatic brain injury patient or TBI in terms of demographics that you see and you treat, give us a little idea about sort of what that looks like.
You know, the classic teaching is that most traumatic brain injury patients, the vast majority of them tend to be young males, because they tend to be involved in a little more dangerous activities. And so, but really, although that is, we certainly see our share of young males, certainly at Hennepin County, it really runs the gambit of patients from, pediatric age group, all the way to the elderly who slips and falls and gets a subdural, and those populations are well represented on our service, and we see a tremendous number of injuries in all age groups.
Great, thank you. And when you think about pediatric TBI, why is it that Hennepin's so darn good at that? When you look at our metrics, we're at the top of the charts nationally. Why is that?
I think in large part it's because of again the people here and the people like your colleagues who bring them here. They get them here as quickly as possible, and that's such an important element for the treatment of these patients. And then there's an extensive pediatric teams that work as well in the intensive care unit that are just phenomenal with that age group as well. So it really has to do, I think, with the quality of the people working here.
Great. And when you think about the pre-hospital care, what are some of the elements of pre-hospital care and TBI for EMS folks that are particularly useful to the patients?
Well, I've seen a lot of run sheets for patients that are brought in, and one of the more important things that we focus on is it's so important for us to know the neurological exam when you find them, because if they have a reasonable Glasgow Coma score and then subsequently deteriorate, we have the feeling that we can be a lot more aggressive and a lot more hopeful of a better outcome. And if they're unfortunately not having a very good GCS when found, it's less likely that we're going to be successful, and it may guide our treatment in the future. So that initial information that you supply at the scene is just so critical to how the whole hospitalization is going to run. That, and of course, the speed element, the ability to get them from that uncontrolled circumstance that you're finding them in and getting it to a controlled circumstance. I mean, that's what you folks do best, and that's what we appreciate greatly. But that makes such a big difference to us.
Great. Yeah. Yep. When you think about the patients as they come into the ED or the emergency department, what happens after they arrive, just sort of briefly, sequentially, if you could describe that maybe for a lot of our EMS partners who, bring patients into the back of the ED and then never really kind of see the ultimate, kind of all the different steps that happen.
Yeah, and it must be very frustrating to not hear always that follow-up because it's very difficult to discern how a patient is going to do as soon as they hit the emergency room, exactly what their hospital course is going to be like. But obviously the ABCs certainly take priority, and once everything is relatively stable, let's say with severe TBI, obviously they're going to get a head CT scan. And then the most important thing from our standpoint is we look at it as a controlling a pressure issue, because if there's something there that is causing increased pressure and in the enclosed cranial vault, then it's going to potentially inhibit blood flow. And so we want to get the pressure down to allow for good perfusion to the brain. So if there's a mass, be it a blood clot in the subdural space or the epidural space, we're going to do an emergency surgery to do that, to take that out, or a blood clot within the brain parenchyma itself. Then we're also, if there's not a specific mass to remove, we're going to place several monitors, and that's one thing that's been really nice at Hennepin, and one of the reasons that I came here originally and continue to practice here is our ability to monitor things that not all hospitals look at. And, the pressure monitor is very important, but we're also looking at other electrolytes in parts of the brain, and also ways to improve oxygenation to the brain. And so it's that type of, really cutting edge research that has really allowed some significant, hopeful changes in the care of these traumatic brain injury patients. So it's a lot more than just the surgical element, but it often starts with the traumatic brain injury with surgery and placement of these monitors to allow for what can sometimes be a very prolonged hospital stay in the ICU, trying to control and maximize those parameters that will give the best outcome in terms of brain function. And most importantly, trying to prevent secondary injury from that trauma. So we obviously with the initial brain injury, you're going to have some direct trauma to certain parts of the brain and tissue in the brain. But what we want to really prevent is that secondary injury to the brain that occurs with an elevated pressure or poor blood flow and the like. And
is our hyperbaric capabilities play a role in this because we're so vertically integrated in that way?
Yeah, I mean, that's we're fortunate to be involved really in a rather substantial nationwide study where we're getting patients hyperbaric oxygen treatment, and it's currently in a randomized study where the idea is basically we'll take patients with severe trauma and randomize them to potentially be getting hyperbaric oxygen treatment, the same treatment that you would give for carbon monoxide poisoning or for, the scuba bends kind of situation, so as to increase the amount of oxygen that the brain sees by just tremendous levels. And we're discovering, too, that it has significant added benefits to the patients for example, it does lower their intracranial pressure after they go on a dive. We're seeing that just that type of treatment is actually lowering the pressure in the patient's head and giving the brain a little bit more room and decreasing swelling. So it's definitely a phenomenal benefit, and it might be one of those things that might eventually become the standard of care, but we'll see how this study washes out. But overall, preliminary things are looking extremely promising.
Yeah, and it's certainly great to have all those tools at your disposal as you work through the puzzle of recovery. Why would somebody with a non-severe TBI, say someone who's walking and talking but altered, be brought to Hennepin? And do you see those kinds of cases?
Oh, absolutely. And, that's, again, it has to do with really the team effort here. The neurosurgery patients, the neurosurgery service sees the TBI patients. Often if there's even a small amount of blood in the head. But you don't need to have a little bit of blood in the head or mixed in with the spinal fluid that bathes the brain to have a traumatic brain injury. And many of the patients who come in have a traumatic brain injury, but no obvious evidence of it on the CT scan, but they've had a concussion. And there's a tremendous TBI program here. And so if they don't need the surgical services, they're certainly going to have the services that go along with the traumatic brain injury care, which, again, it's a large group of people. It involves physical therapists and occupational therapists and physical medicine and rehab physicians as well. So what it does is it's really created quite a program that allows for the care of these patients. And I hate to use the term mild TBI because it's not mild if it's you,
right,
or a loved one, and the things that can come with that concussion and that injury are terribly frustrating for patients. And there are definitely some things that can be done to help with those symptoms and treat those symptoms. So although we tend to see and operate and care for a lot of severe traumatic brain injury, there's an equally, if not much larger group of mild and moderate traumatic brain injury patients who need those very important services to recuperate and get the maximum improvement possible.
Great, thank you. And then as we wrap this up, because we always want to be mindful of our responders' time, it's always so precious, run to run. Anything that we didn't cover that you want to just speak to?
How much we appreciate what is being done by all the men and women in your ranks, and we can't tell you how important it is to that you're taking, again, those patients from that uncontrolled circumstance and bringing it to a controlled circumstance and in such a quick manner. And the information that you already provide for us is phenomenal. I also do the concussion protocol for the Vikings, and I have the great pleasure of spending a lot of time on the sidelines with the EMT teams that patrol the sidelines along with us, and I certainly enjoy that camaraderie, and I know what a fantastic group of caregivers you are.
Yeah, and also very gregarious.
Yeah, absolutely.
Great. Well, thanks, Walt. I really appreciate it.